Welcome to another episode of Ruddle on Shape, Clean, and Pack. Today my assignment will be to talk about canal preparation. And certainly when we think about canal preparation, we think of a lot of different things that mean something different to each one of us. But certainly the instruments we use to create the shapes in these various routes are critical and will in some extent dictate final results. Today I'm going to talk about specifically ProTaper universal, and of course we can reciprocate instruments, we can spin instruments, and these critical distinctions will be covered later in the show. But when you think about the micro CT work that we see in various textbooks and online around the world, some of these systems are very complicated and formidable. Our job is always the same, a complete access. And then, of course, we have to catheterize the canal and create a smooth, reproducible glide path. So all my discussions about shaping are limited by the assumption is you have a glide path. And we talked about previously the instances where you have a reproducible glide path versus when you have an irregular glide path. And those have different management schemes. Well, when you look at all the file systems in the world today, it's a staggering upwards of 30 different systems are available to clinicians internationally. But one thing that can immediately be said is that all instruments in the world today have fixed tapers except for the ProTaper family of instruments and Wave 1. Today I'm talking about ProTaper, but I think it's important to look at all other systems to appreciate their fixed tapered files. What we know about a fixed tapered file is the following. Maybe not the first instrument, maybe not the second, but certainly by the third or fourth instrument, the shape of the file is rapidly preparing the canal so that the canal is rapidly becoming the shape of the instrument. And when an instrument has a long engagement zone, it invites taper lock. And taper lock means there's a lot of excessive contact between the blades of the instrument and the surrounding dentin. This means the instrument has a tendency to screw or feed into the canal inadvertently. So various manufacturers have done different machining concepts to mitigate taper lock, and you can find these in the various systems. But all instruments except for ProTaper and Wave 1 have fixed tapers. The problem then with fixed tapers is the screw effect, taper lock, and it usually takes quite a few instruments to impart the desired shape. In 2001, ProTaper launched, and it launched as the first active file in the world. It was also the first file that had changing tapers on a single instrument. It was also the first system in the world that could give you the fewest instruments to create an ideal deep shape of about 8 to 10%. The fewest instruments to create the most optimal deep shape. ProTaper shapers have increasing percentage tapers. And on the image on the left, you can see that the tip of the file is basically non-active. The tip of the file is to guide the instrument through the glide path. So there's a big assumption here, and the assumption is you have a smooth, reproducible glide path. ProTaper files should not be used in any route until the canal has been catheterized, expanded, and enlarged to a 15 hand file. When you have a 15 hand file that's loose within any region of the canal, it is not possible for the end of a ProTaper shaper to engage dentin. This pushes the workload up to the bigger, stronger, and more efficient blades. This is the antithesis of how all other files on the planet work, because in crown down techniques, instruments typically lead with their more delicate, smaller, and less efficient blades. The finishers are just opposite of the shapers. The finishers have decreasing percentage tapers over the length of a single blade. As an example, if we're looking at the right image and we assume that the apical 1/3 that's shaded is 8%, then behind the fixed taper in the apical 1/3, we have decreasing percentage tapers of 7.5%, 7%, 6.5%, 6%, and 5.5%. By decreasing the percentage taper, we have two significant advantages. Number one, the instrument's more flexible. This helps us go through multiplanar curvature. The other more important idea, perhaps, because most curvatures are in the apical 1/3, but the second most important thing is probably the finishers do not continue to enlarge the canal in the coronal 2/3. This means we maximize remaining dentin. This means we do not overexpand preparations where we can thin roots out and predispose to longitudinal fractures, or worse yet, we wouldn't want to strip perf the root, and then that would create another whole series of problems to overcome. So shapers, increasing percentage tapers over the length of a single blade. Finishers have decreasing percentage tapers over a single blade. Together, finishers and shapers deliver a uniform taper over the finished preparation. If we look at the family of instruments, you can see, following the ISO colors that are well known internationally, we have a number of instruments that can help impart the shape. We basically can divide the family of instruments into shapers and finishers. Classically, you'll hear most people discuss the purple and white as being the ProTaper shapers, and then yellow, red, blue, double black, and double yellow banded handles are our finishers. To round out the shaping family of files, there is a file that looks short to you, and it is short. It's only 19 millimeters in its overall length. This is called the auxiliary shaping file, or Shaper X. Shaper X is used for two reasons. One, it helps you in the access game get radicular access. We can use this to flare orifices, marry orifices to axial walls, and finally we can use it to remove triangles of dentin. The second application of Shaper X is to help you treat and get a full shape in the body of the canal on anatomically short teeth or in badly broken down teeth. Let me make a critical distinction. At D6, D7, D8, and D9 of Shaper X, you have a GG equivalent of a GG1, 2, 3, and 4. This means that D6, the cross-sectional diameter is equivalent to 5/10 of a millimeter. At D7, it's 7/10 of a millimeter, D8 is 9/10 of a millimeter, and D9 would be 1.1 millimeters. This means at D9, 1.1 millimeters, you have the same cross-sectional diameter as the purple and white are at D16, which are about 1.1 millimeters. So to say it in another way, you can probably imagine as we sit on this slide that there would be a case that's short. So if your tooth was badly broken down, or just naturally you had a short anatomical tooth, you can probably imagine the tip of the purple and the white are at the terminus. But maybe the most important blades, the big ones, up towards the shaft are still up in the pulp chamber. How do you get the shape of those blades down below the orifice if you're already at length? The secret is to use the auxiliary shaper, because again, at D9, this file's cross-sectional diameter is as large as the purple and white files are at D16. If we look now and focus more on the finishers, the yellow file on the left with the yellow band on the handle, it is finisher 1, F1. It has a tip diameter of 2/10 of a millimeter and a 7% taper. But wait a minute, the taper is only in the apical third. So 7% is a fixed taper from D1 to D3. Behind the fixed taper, in other words from D4 to D16, we have decreasing percentage tapers as previously discussed. And to go on quickly, the red one is a 2508, the 3009 is the blue handled file, and the two black stripes are suggesting it's a 4006, and finally the two yellow stripes on the handle means it's a 5005. So you have a variety of different finishers to address a myriad of different anatomical configurations. There are many advantages to the ProTaper files, but first of all, anytime you change the taper on a single file, it improves the safety of the instrument. In fact, it makes the instrument safer than all similar sized instruments, because fixed tapered instruments tend to be a little bit more grabby, but by changing the taper, you have a very small engagement zone and instruments don't tend to screw, and breakage has been shown in different Journal of Endodontic articles to be lower in a changing tapered instrument. ProTaper, as I mentioned earlier, was the first file in the world in 2001 to be an actual cutting blade. So that means it's an efficient instrument, and it is not a landed instrument. It has an active edge. And finally, as I've also said earlier, but to bring these points home, with just three instruments, we can create a deep shape of between 8, 9, and 10%. That may throw some of you because you're thinking the yellow file is a 2007. So how is Ruddle getting that out to about 8, 9, or 10%? The secret is brushing. The ProTaper shapers are used in a brushing motion, and by brushing we make lateral space. And by making lateral space, we can make more space than the numbers or geometries of any given instrument would otherwise suggest. So when you throw these three things together, it gives you a wonderful set of mechanical instruments that rotate and carve shapes. In this instance, we have a very dilacerated ex vivo tooth, and you can see we have a 15 file around a significant curvature in the mesial system. Again, the key is to have a smooth, reproducible glide path. When we have a smooth, reproducible glide path, we can consider using a snap-on handle. I would never rotate a 2508 F2 around this kind of a curvature, but manually you can see perfectly the instrument is around the curvature and at length. Well, if we go to the laboratory and look at some histological sections of that exact same tooth, you can see the principles of ProTaper on this shaved down root. Notice the finisher, the 2508, is only engaged in its terminal extent. Notice the instrument is loose around the curvature and in the upper 2/3. That's because the shapers prepare the upper 2/3 and the finishers blend the deep shape into the body of the canal. This was done with manual ProTaper. And of course, if we have a smooth shape, it's quite easy to slide a matching ProTaper F2 gutta percha cone around the curvature and to length. So we have a set of ProTaper files, and although you have several instruments to choose from among, most posterior teeth can be shaped with 3 or 4 instruments. An important distinction with ProTaper, as compared to all other file systems again, is we use a high torque. And that's because you need a high torque on any instrument that there are changing tapers over a single blade. We use a single speed of about 250 to 300 RPMs. I really won't quibble with you on the speed selection, but we need to be in agreement that it's 520 gram centimeters for all ProTaper files. It was an interesting article by Elio Berruti in the April issue of the Journal of Endodontics. In 2004, he talked about the importance of high torque. And even though the manufacturer mandates in their DFUs, their directions for use, that you should change the torque from file to file, Elio showed that if you change the torque from ProTaper file to ProTaper file, you can have a significant increase in broken instruments. The final analysis in that article, and this was something that was discovered during the actual creation of the instruments, and it was verified and validated by engineering reports, that 520 is the proper high torque that's required to effectively use ProTaper instruments. Let's look at a clinical op and try to look at the technique now in continuity as we shape the mesial buccal canal of this mandibular first molar. Notice this first molar has a clinical crown on it, porcelain fused to metal. Notice the pulpal roof and floor are quite close in a proximity. You can see the horns emanating up towards the occlusal table, and they disappear under the restorative. Importantly, notice the entry angle of the coronal 1/3 of the mesial systems into the pulp chamber. Note that awkward curvature into the chamber. The crown will be removed, but first let's just review the sequence. In a sequential glide path, and in a sequential shaping method, we scout the coronal 2/3 of the canal first with 10s and 15 files. Once we have a secured canal in any portion of the overall length of the canal, this can be shaped. This region can be shaped readily with purple and white, S1 and S2. And once the upper 2/3 has been optimally shaped, we would then, for the first time, introduce small size, most flexible hand files into the apical 1/3. So we're going to carry a 10 and a 15 file to the full length. This is when we would take a working length film or use an electronic apex locator. This is when we would make sure we're patent and that the canal is not obstructed apically. And this is when the decision would be made, do I use mechanical instruments to shape the apical 1/3, or would I best serve the patient's interest by using a manual ProTaper finishing technique so that we don't risk breaking instruments? So the big three, working length, patency, and glide path, is only determined once we have done coronal pre-enlargement. If we can get a nice, smooth, reproducible glide path in the apical third, then this region can be mechanically shaped with 3 instruments, typically the S1, S2, and F1, and then we'll look at another segment of finishing criteria to know when do we actually know we're done shaping any given root canal system. So in a sequential glide path, we're going to focus first in the upper 2/3. And as another reminder, we're taking the clinical crown off with the metal lift. The metal lift can be looked at more effectively if you go to the website metallift.com. So again, if we look at these two x-rays side by side, I'm reminding you on the right x-ray that I'm not going to carry my initial instrument to the full working length because that's a different kind of preparation. But in a sequential glide path, we're going to pretty much divide the canal into the upper 2/3 versus the apical 1/3. Let's get started. So when we have the tooth isolated in profound anesthesia, we would syringe in ProLube, Glide, or RC Prep, and we would begin thinking about creating a coronal 2/3 glide path. There's no preconceived notion where any of these instruments go. Wherever they go is where they go. By reciprocating the handle gently, that'll draw the file down into the canal. When the handle is just snug, pull. So we speak of feed it in, pull, feed it in a little bit deeper, pull. Each feed it in pull is a cutting cycle. And I use 6 cutting cycles with the 10, followed by 6 cutting cycles with the 15. Each cutting cycle serves to smooth and expand and refine the glide path. Watch the rubber stop come down. Watch the rubber stop come down. This represents the level of the secured portion of the canal. We're going to take out the 15 file, and we're going to have the assistant measure this loose 15. Once the 15 file has been measured, we now know the glide path is 17 millimeters long. This length can be transferred to the first ProTaper shaping file, and we set that stop at 17 as well. It's critical that we never let the tip of the instrument run into no man's land. We never carry any given file apical to where we have a secured glide path. In this manner of sequential preparation, we always know we're inside the slide path and the rotary instrument can work safely. Recall, the tip of this instrument will do virtually no work, as most of the workload will be pushed up to the bigger, stronger, and more efficient blades. It is now time to irrigate with sodium hypochlorite. I use a 6% solution. When we mix sodium hypochlorite with a viscous chelator, we get effervescence and a lot of bubbling. This tends to churn and deliver debris coronally. We float into the canal and we immediately begin to brush. We brush away from furcal danger. By brushing, we make lateral space. It's important to note that by making lateral space, the bigger Eiffel Tower blades of the ProTaper shaping file are free to move deeper. And through a series of brushing and floating and following, the shape can be created and carved out to the level of the glide path. Irrigate, recapitulate with a tin file to break up debris and to move that debris into solution, and then re-irrigate to liberate that debris. We always work in a bath of 6% sodium hypochlorite. It's interesting to work with assistants and train them so we can exchange instruments to benefit the economy of time. By taking in the white instrument, we can now begin to shape with S2. Brush, brush, brush. It's deliberate, it's intentional. You might even ask the patient to hold their head strong. I'm trying to convey to you that the brushing is quite firm. And again, by making lateral space, the instrument's completely disengaged during almost its entire shaping exercise. The rubber stop is allowed to advance, and when it meets the selected reference point, you're at the apical extent of the glide path, so always irrigate, recapitulate with a tin file, and then re-irrigate. This is a very controlled way to work in the apical third, the viscous chelator. The viscous chelator allows the instrument to be lubricated, and we can drag by surface tension critical reagent on the blades of the file. We can get that instrument to work down through the apical 1/3 and to length. The 15 file is then brought in to expand the glide path to at least the dimensions of a loose 15. The 15 file oftentimes is a little further away than the 10 file was, in that it's 50% bigger at D0 than the file that preceded it. Once I've worked a 10 and then a 15 file to the radiographic terminus, I need to confirm the vertical extent of treatment. This can be done either with films or it can be done using an electronic apex locator. Here you're looking at J. Morita's Root ZX, and this is the most popular apex locator in North America today. Notice the digital display is fully illuminated to apex. I'm not working 1 millimeter short or 1/2 millimeter short. I'm actually working to the apex, which means you'll get an audible noise and you'll also get a light flashing. So 3 things will confirm you're where you want to be: the digital readout, the audible beeps, and the lights flashing. Now, how do you know if the apex locator is telling you the truth? It's important to move the file back about a stop, and again the stop is about 1 millimeter, and if we were to move the stop back about 1 millimeter, you would expect the digital readout on your apex locator to move back about 1 millimeter. Basically what I'm saying is, when the fingers move the file back about a stop, which is about 1 millimeter, your digital readout should move back about 1 millimeter. Pretty much the readout should simulate exactly what your fingers are doing. And if that is the case, you can have a lot of confidence in your electronic apex locator. Irrigate, use a tin file to clear the frame of any mud that might have been generated with the 15 file, and confirm patency. The canal was patent before we ever went into it, so let's make sure it's still patent, because rotary instruments cannot follow a block canal. Now I'm checking the glide path. Notice I'm moving the 15 file back about a stop and sliding back to length. Now I'm moving it back about 2 stops and see if I can slip and slide back to length. If I can slip and slide and glide over the apical 1/3, then I have confirmed clinically that I have a glide path, and it would be safe to use mechanical instruments to shape the apical 1/3 of this canal. Irrigate to liberate viscous chelator. Again, you'll notice a lot of effervescence. Recapitulate with a tin file, and that's patency. And then re-irrigate to liberate that debris. We can now carry the S1 to length. And usually, in 1 or more passes, we can achieve length. If it's a fairly straightforward canal, we can get there pretty much in 1 pass. And notice when you pull out the instrument where the debris is located. If you see debris towards the terminal extent of any given file that's a shaper, you're about ready to break the file. The debris should be more optimally located on the bigger, stronger, and more efficient blades. After every shaping file, irrigate, recapitulate, and re-irrigate. We can now go to the S2. The S2 floats into the canal, it follows the expanding shape, and again you begin to brush. And again you're carrying another shaping wave progressively deeper towards the apical 1/3 and into the apical 1/3 of the canal. Again, brush away from furcal danger. Maximize remaining dentin. Relocate the preparation coronally away from any external root concavities. Irrigate, recapitulate, and re-irrigate. These are little redundancy steps, but redundancy is the mother of excellence. You always are one file away from victory and one file away from defeat. This is the first finisher. It's the 2007. It is not a brush. It moves straight into length again in one or more passes. Notice where the debris is loaded. On a finisher, you want to see debris on the apical extent of the file because it confirms this file just cut its shape in the apical third. Again, irrigate, recapitulate, and re-irrigate. It's always good to know you have a smooth, reproducible glide path and that the terminus is patent. Here I am gauging with a 2002 hand file. If the file is snug at length, my shape is done. I like to fit the cone exactly at this moment because I have the preparation objectives clearly in my mind. I'm using a matching ProTaper cone. I'm using red. Oftentimes you can use yellow. If yellow goes to length, oftentimes I'll try red, and red will oftentimes be maybe at length or just a little bit short. But whether you used a red-headed cone or a yellow-headed cone, the point is ProTaper has matching gutta percha points, and these are used and pre-fit prior to packing. With the cone fit, of course, we would radiographically confirm it because that would confirm all the operative steps to date. I want to show you in the other mesial system something that might be quite interesting for you to see. Let's look. I shaped the MB and the ML together, and here's the gauging file that is at length and it's snug. Notice that each larger successive instrument will not move into the canal as deep. I'm simply having my rubber stop pushed down by the dental assistant, and I'm going through a series of file. I'm not working these instruments. They're simply placed into the root, and the assistant pushes the stop down so that I can look at all the instruments in a series and look at the relationship of the rubber stops to each other. And this is how it would look. If you have the assistant show you in a sponge all the instruments that we just looked at going into the MB system, you'll notice that each larger instrument is uniformly moving progressively away from the radiographic terminus. Notice that each larger instrument is about 1/2 stop short of the previous smaller sized instrument. If you see the instruments moving out in a progression like this, you could actually, in your mind, visualize the shape you've just imparted to the root in question. If we were to look at this in animation, we're just saying that tuning is a clinical activity where we confirm that each larger file uniformly backs out of the canal. So what is our taper? We only use 3 ProTaper files. The largest finisher was a 2007, but you can see in the little formula up in the upper left that it says the taper's 10%. Well, the interval of backout between successively larger files is 1/2 millimeter. So we're dividing 1/2 millimeter into the D0 change in diameter between successively larger files, and between a 10 and a 60, all ISO files get bigger by 0.05 at D0. So if you divide 0.5 into 0.05, you can see that we're using 3 instruments to get 10% shape. Again, we can get more shape than the finisher would suggest because we're brushing with the shapers. One closing comment: if any given ProTaper file doesn't want to move progressively deeper into the canal, recognize the blades are loaded with debris and the instrument should be withdrawn so you can clear the flutes. Then irrigate, recapitulate, and re-irrigate, as we've mentioned, and use the same exact instrument and it will invariably move deeper into the canal. If you look at the postoperative film of the tooth we just looked at clinically, you can see the mesial systems are well shaped. There's an anastomosing between those systems and there's a little bifidity apically. The endodontics is simple. It's not so complicated, but it goes to show that ProTaper can use 3 instruments to give you these kinds of shapes, and well-shaped canals allow for dynamic irrigation, and dynamic irrigation cleans into the inaccessible areas of the root canal system so we can fill root canal systems with warm gutta percha and sealer. Notice the crown has been replaced provisionally, and I'll let the general dentist decide if they want to utilize this crown in the future or if a new crown in fact should be made. To summarize the ProTaper technique, you can go to my website and download this technique card for free, but it is a nice way to look at the technique in a very simple way. Notice we're doing a sequential preparation. We're using small-sized hand files, 10 and 15, in the upper 2/3 to create a glide path in any region of the canal. Once you have a glide path, you can shape that region with 2 instruments, S1 and S2. When the upper 2/3 is optimally pre-enlarged, we can now use a viscous chelator to scout the rest of the canal. And I mentioned that when we scout the apical 1/3, we've already made a more direct path to it by doing shaping procedures in the upper 2/3. This means when we get working length, it'll be more accurate and less likely to subsequently change. So the 3 things we like to do when we scout the apical 1/3 is we get a known working length, we need to confirm the canal is patent and not blocked or obstructed, and finally the decision should be made right here with the 10 and the 15, do I have a reproducible glide path? If the answer is yes, then this region can be mechanically shaped starting with S1 and irrigating, recapitulating, and re-irrigating after every rotary file and going through the series minimally to an F1. If you gauge with a 2002 hand file and it's snug at length, the shape is done. If you gauge with a 2002 hand file and the file is loose at length, it simply means that the foramen is bigger than the F1 file. And you can see that we have the F2, the F3, the F4, and the F5, and they can be used as needed based on the case. I appreciate your attention, and I'm sure if you're not already a ProTaper user, you're going to find these instruments extraordinary in their ability to carve out a smooth, reproducible shape that's conducive for any dentist to fill in 3 dimensions.